Hello, everybody. I'm back. Dr. K.K. Agarwal, President, Confederation of Medical Association of Asia and Oceania, and President of Heart Care Foundation of India. And you are watching Med Talks with Dr. K.K. Agarwal, 7 p.m. daily show, 172nd non-stop edition. Let's have the headlines of the day. Med Talks viewership crosses 2 million. The Union Health Ministry warns people about fake mobile applications that sound similar to the upcoming official application CoVIN, which is COVID Vaccine Intelligence Network. Nearly 1 in every 2 COVID patients in Delhi who have history of travel to the UK or direct contact with the returnees have been found to have mutated strain of the coronavirus too. Rise in COVID admissions in private hospitals in Hyderabad delays plan to shut down separate wards. The United States logged over 3,900 COVID deaths in the last new 24-hour record. About 50 years and not on voters list. Don't worry and self-register for vaccine by using any legal photo identity card. Doesn't matter whether you are on the voters list or not, any legal photo identity card and you can register yourself for the vaccine if you are a 50 plus, and if you are a 50 minus, you may require a medical certificate that you have a comorbid condition. Before I introduce you to the subject and my special guest, let's do our ritual of washing our hands, which is a customary. S for Seedha, U for Ulta, M for Mutti, A for Angutha, N for Nakhun, and K for Kalai. So once we have done that, we always welcome our guest after we wash our hand. And my guest today is Dr. Gamze Varol, the chairperson of Turkish Medical Association. I have already told you in the past that every week we will bring you an international expert. She was with me as a member of World Medical Association in a couple of meetings. Today she is representing the Turkish Medical Association as the chairperson. Let's have the topic of the day.
Hello, thank you very much.
So you can see in the background, she will be talking about the Turkish experience. Let me introduce her to you. She is the chairperson of the Turkish Medical Association. She is currently working as the head of Department of Public Health at NKU Medical Faculty. She is also a member of Turkish Public Health Specialist Association and works in executive board on the Public Turkish Medical Association Health Branch and the Right to Clean Air platform. Her field of work are environmental health, occupational health, and chronic diseases. So she will be giving a small presentation before we interact with each other. Over to you, Gamze Varol.
Thank you very much. Thank you for me this opportunity. Actually, it's an honor to be here. It is also an exciting and difficult situation because we met COVID-19 more than a year in the world. So it's pretty difficult to explain how pandemic is going on Turkey, especially in view of public health. So as possible, I am planning to share some important basic issues with you. If you can write your questions and contributions, I will try to respond quickly from here, so I can make use of time more efficiently. Actually, we know a lot of things, structure, characteristic, transmission routes, and so on of the new coronavirus compared to the beginning. But there are still many unknown. It remains a mystery. So in this point of view, sharing country experiences of vital importance to learn lessons from mistakes, creating evidence and guides, and managing the process correctly. Because new coronavirus is not only a virus, but it has also created a chaos that will affect the political and economic stability in many countries. Pandemic, contrary to popular belief, has deeply affected not only undeveloped or developing countries, but also many developed countries who think that they can overcome infectious disease and manage any epidemic well. There have been many extra and otherwise preventable deaths and illnesses, especially among healthcare workers. Health systems were reviewed, and the preparedness of countries for extraordinary situations was questioned. While the pandemic increased inequality in one hand, it has also negatively affected the economies. Therefore, maybe we can syndemia, synergistic epidemic. However, in the struggle with COVID-19 was needs more basic, structural, and social solutions. For this reason, I will try to talk about the fight against COVID-19 in my country with a critical point of view. Next slide, please. Thank you very much. I prepare some slides for you because too easy for me to explain what was going on in Turkey. I try to draw a timeline, and I will show you some critical things on my presentation. While disease was heard, we addressed some critical point of pandemic management. First, Turkish Medical Association, working together to struggle with the disease management, asked the Ministry of Health. But unfortunately, we could not collaborate. So Turkish Medical Association established COVID-19 scientific board as separate. According to Ministry of Health, the first activity was establishment of Operations Center and Scientific Committee at the beginning of January 2020. The both committees published and share many guides of different occupational area, but important one issue that a guide for healthcare professional about on COVID-19. By the way, after we learned in timeline, you can see we closed the Iranian border because we learned there are many cases in Iran. Iranian border was closed 23rd of February. After we learned Health Ministry said that first case was announced on 10th of March. This date coincident the same day when WHO gave the pandemic alarm. The first case was a young man who ran a tourist shop in Istanbul, and first death was, as you see, on 14th of March. She was working in a private hospital. She was a young woman, has a chronic illnesses. And 1 week after the first case, the number of cases increased rapidly and reached almost 200, as you see. Because of the cases rising rapidly, other borders closed too. And go on. While the cases are progressing rapidly, guidelines and algorithms change, published by the Ministry of Health, and a number of public health measures have been taken and some restrictions were brought. For example, on 16th of March, education was suspended in schools and universities, as you see, and mass prayers in mosques were prohibited. On 20th of March, various scientific or cultural gatherings, etc., were postponed. After that, while barbers and hairdressers stopped working, only the delivery service of the restaurants were approved. On all hospitals were defined as pandemic hospitals. On the same day, people aged 65 and over and under the 20 and those with chronic disease were prohibited from going out, and also the rest of the people were restricted in open areas such as parks, gardens, and beaches, etc. On March 22nd, it was observed that while some restrictions such as flexible working were imposed on working on public institutions and organizations, no regulation was made to the private sector, and the decision was left to the companies. And wearing masks and to maintaining physical distance was made obligated in Turkey in the April 2020. But as we see the top of the slide, right side, while the cases are progressing rapidly, curfews were introduced toward the middle of April. These curfews and entry and exit restrictions were applied in almost 1/3 of large and air-polluted risky cities in Turkey. These restrictions lasted 2 to 4 days on weekends and official holidays. It started at the end of April and ended at the end of May. And as you see at the beginning of the talk show, there is an application was made. There was an application was made. It's called HES in Turkish. It means in English, Life Fits Home. If you want to go outside any public and private company, institution, you should show from that application you are not sick. The application has many benefits also for the citizens, such as to take some free mask or to learn risky locations, something like that. And as you see, in the middle of the May, President gave some good news about controlled reopening, getting normalizing. But we did have not 0 case or death a day, even end of the May. All NGOs and professional chambers, health organizations said no, such as Turkish Medical Association. It was early. We said to government, please use the decision making on the basis of public health and epidemiology science on management of pandemic. Next slide, please. As you see, in the May 2020, the government decided to normalizing, but we have many deaths and cases in Turkey. Next slide, please. Yes. I wrote some questions to us. Some of them, were the restrictions and prohibitives timing right? Actually, in 1 week, as I show you, escalated later from local to country. 1 case increased, 200 cases in a week. So this proves that the date of entry of the virus into the country is earlier than the first case and has multiple key. And it also means Turkey was late in detecting cases and taking necessary precautions. These have been implemented. Yes, these have been implemented is good. But if we could do just before and longer, many deaths could be prevented. This have been enough. Social sports, not enough in Turkey, actually. No regulation was made to private sector, as I told you. And this decision was left to the companies. It's different apply. Is the right decision to normalize on 1st of June? I want to answer the next slide, please. Yes. Thank you. Turkey experiences in COVID-19 phase 2 after the 1 July 2020. because I told you President gave some good news. Yeah, we have to normalizing. In the guideline prepared afterwards, the point to be taken into consideration in the reopening were shared, and it was stated that the closed institutions would start to reopen sequentially after the 1st of June. The measures to be taken in those institutions were explained. For example, after the 1st of June, borders and public places were reopened, and after 1st of July, social and scientific gatherings were allowed. Since the outbreak began, the Ministry of Health has been reluctant to share data on the outbreak despite persistent demand from especially health professionals such as Turkish Medical Association and academia and scientific persons. The Ministry of Health still does not transparently disclose all the requested data regarding the epidemic. Therefore, we can make a limited epidemiological assessment of the epidemic. After controlled reopening, getting normalizing, announcement, many things change, again, controversy. In the guidelines prepared afterwards, the points to be taken into consideration in the reopening were shared. It was stated that the close after the June, as I see you on the timeline, 1st of June until 1st of September, it was a season holiday. After the season holiday, the cases are getting increased slowly. But unfortunately, even according Ministry of Health cases and deaths record due to COVID-19 started to rapidly increase, as you see on the graphics top of the right side of the slide. The second week of October especially, they started to rapidly increase case and deaths. So despite the inconsistencies and shortcomings in the number of data announced, the increase in the number of intubated and the serious patients, especially after the third week of October, it was scary because the real data would be more than this. Next slide, please. As you see, there are two separate peaks. First peak during April and May. The second one is bigger, as you see, is bigger. The epidemic trend seems like decrease in last 10 days, but we need to learn from early normalization from phase 1. This is not the relaxation time. There are also other dangers waiting us. In the winter months, the burden of pandemic may be higher if people have to spend more time indoors where ventilation is insufficient. With the increase in the incidence of seasonal influenza, because the influenza vaccine has not been fully administered to risk groups yet in Turkey, and other respiratory tract infections disease will lead to more severe COVID-19. In addition, ambient air quality is not good in Turkey, especially in the winter. Air pollution, we think, is another danger for COVID-19. Next slide, please. Yes, the questions again, after the phase 2, is it the right decision to normalize on June 1 first? No, it was earlier. Were the restrictions and prohibitions timing right? No, it was late. Yes, it is necessary, but it was late. I can say the epidemic is still continuing in Turkey. As you see, the table from Ministry of Health, yesterday's number. As you see, there is so much case deaths and number of recoveries, number of critical ill patients. We have more time to spend, I think, try to spend to cover this pandemic. Next slide, please. What else? As of the end of the 10-month period, the first wave has not damped down enough yet. Or second wave or continuum of the first wave, what you say. Health institutes, hospitals are working at full capacity, so are the intensive care units also. Health workers have burnout. That's why health systems are negatively impressed. Next slide, please. Main problems in Turkey, I want to tell you shortly. There were serious deficiencies in the pandemic management plans of Ministry of Health, we think. We don't know the true magnitude of the pandemic in Turkey, and Turkey has unclear and insufficient test policy. What I meant, yes, we made a pandemic plan in Turkey, but we could not use it very good. We pretend to use it. For example, there were no experts in pandemic committees until March. In the first form of the board, public health experts were not included, the health professionals group. Similarly, in the local district too, and data not shared with scientists. And we don't know the true numbers of COVID-19, actually, true numbers of cases, mortalities, and patients. Also, we don't know how distribution by region, sex, occupation, etc. There's confusion in the terminologies used by Health Ministry in the COVID-19. For example, in the reports and announced, Turkey used their own definitions and descriptions without the WHO or CDC definitions. There have been also serious difficulties and death notifications. For example, people who were diagnosed with COVID-19 clinically and radiologically and who has received COVID-19 treatment were not registered at COVID-19 because PCR negative. And when they died, the cause of death was not stated as COVID-19. So please go on. Please, next slide. Okay. As you see, two table, 9th of December and 10th of December 2020. In one day, can you see the differences, the number of the disease and number of the cases?
Yes.
That's what I meant.
10 April and 9 April. So there was a significant difference.
Yeah. In one day?
Yes, 2000.
Yeah, in one day. Mm-hmm. And next slide, please. And there were serious problems with personal protective equipment at the beginning of the epidemic. And pandemic communication was another important problem. I want to tell you something. Serious problem occurred in pandemic communication in Turkey. Data was not shared clearly, as I told you. Data sharing requests from the scientists and health professionals were not responded positively. Turkish Medical Association found many inconsistencies between the disclosed data from the health ministry and the observations and information received from the network of physicians. Data were reflected less than it actually is. In addition, this situation caused the risk to be perceived lighter by the citizen and increase the virus transmission. Early opening, normalizing led to a relative comfort for the public also. This situation caused the health workers to relax and the protective measures to be relaxed, and the health of health workers affected so negative. So we need more good communication. We need more true data. For example, about the health workers, government reported on 1st of April that 600 healthcare workers were infected. Within a month, this number had reached 7,000, over the 7,000. Until now, we know that almost 400 healthcare workers have lost their lives. And professional organizations struggle to make COVID-19 an occupational disease for healthcare workers. And another problem is in Turkey, academic freedom is under the danger. What I meant, I want to explain. Conducting studies in COVID-19 in our country, collecting data, being scientific researchers were to the permission and approval belong to the Ministry of Health. This has led to many discussions and application, and this application was interpreted that as academic freedom was under the danger. And another problem is in Turkey's social support. During the process, it was observed that made arrangements for social support, flexible working, partial rent support, postponement of loan debts, etc. However, especially for small and medium enterprises, these supports were insufficient. Most employees were sent on unpaid leave. Many businesses went bankrupt. Large enterprises stopped production for a few months, but then they continued to work. They have to work. All the attempts have been made to comply with the guidelines prepared on how the working on conditions will be these enterprises, factories, and so on. Working areas have increased the spread of the virus in the community. However, at the point reached, no separate heeding related to the epidemic was encountered in the 2021 budget in Turkey. And the vaccination, Ministry of Health announced that it will bring 50 million doses of coronavac vaccine from Sinovac in December. It was reported that healthcare workers will be vaccinated first, but we are waiting now phase 3 study results. I think there is a problem in here. Next slide, please. Evet, finally, we can come at the solutions. What we need to do, actually, we need to breaking the infection chain in public, not waiting to be treated in the hospital. We need making with scientific and epidemiologic grounds, not decision with economic concern. We need more prioritizing public health solutions, not individual solutions. We need keeping distance away from decisions that corrupt nature and ecological balance. It should not be forgotten that the main things is to change the conditions that reveal pandemics. The main thing is to prevent contamination and illness. We say stay at home, how the most important condition for the people to stay at home is accommodation, nutrition, care, etc. Is that they have no worries disrupt. In addition, the economic crisis affects the citizens' social life, occupational life, education, expectation for the future deeply. Formal education has been negatively affected, even if it is tried to be constructed remotely. Apart from the disease burden directly caused by the pandemic, medical school education, primary health care services, chronic patients following up, and treatment were indirectly affected by the pandemic. All of them are important issues and preconditions of health. Finally, as my presentation, I want to say I'm sure what I tell you, all of these, not only in Turkey but in many countries. But there are good examples of countries, as we know, or there are good practice in the epidemics. We can pick up good practice and use them as much as possible. However, early opening due to mismanagement or economic reasons led to many deaths and illnesses in many countries, like in Turkey, because it seems that there will be more extraordinary situations and pandemics in the world where ecological destruction is so great. The truths and wrongs should be discussed so that lessons can be learned, hopefully, for the next pandemics, and the same mistakes should not be repeated, because most of these deaths could be prevented by structural measures. Next slide, please. And thank you for listening to me and inviting to me my medical association. Especially, I want to tell you this photo from the Istanbul Marmara Sea. Have a nice, healthy, happy New Year. I want to wish you without COVID-19, of course.
Thank you. Thank you very much for elaborating all the measures taken in Turkey. Now I'll go back to some basic question answers so that we can debate. Whenever we see a second wave,
yes,
we have also seen a second wave in Turkey. We have seen them in European countries. And if the second wave is earlier, stronger, and wider than the first wave,
yes. We live second wave.
Why should we have a second wave which is stronger than the first wave, which is wider than the first wave? Either it has to be a change in the behavior of the people, or it can be a new mutation. Have we ruled out a new variant leading to second wave in Turkey? That's my question.
No, thank you. Thank you for the questions. I don't think so. It is not related to new mutant virus. It is related to, we think, early normalizing, and misunderstanding, misadministrating the pandemics.
Okay, so one thing is that we have tested and confirmed it is not a new mutation. I'm not talking about.
No. There is a mutation in Turkey. We detected a few days ago, but it is not responsible for the phase 2.
Okay. Now the first that mutation in Turkey is different than that of UK and South Africa.
Actually, I want to tell you about something like that. There is a difference. Yes, there is a difference. We have detected the UK strain in Turkey, but there is no find any South America strain in Turkey. We cannot find it.
Okay. So your strain is not a special Turkey strain.
There is no there is no special Turkish strain virus.
So predominantly it is 614, which is predominant all over the world. Is it the same
uh,
614 mutation?
it
Because the
is
UK strain is 501.
In Turkey, we found that our virus strain very similar to Chinese virus,
Okay.
Chinese strain.
So the original Chinese strain is still
Yes,
persisting
so
in
similar.
Turkey, something like
Yes.
L strain, because the first one L, then S, and now predominantly it is a G strain which is occurring. Number one, what is the mortality and how did you reduce the mortality in Turkey? How are you reducing the mortality in Turkey?
Actually, our mortality rate is 2.5%. We try to good management on the field, and we try to help in the hospital, a new hospital. We try to establish new hospital and new hospital beds and intensive care beds. We try to increase them to manage the good manage and decrease the rate of mortality.
Okay. Is there any role of early steroid, early blood thinner? Are you following that? Early corticosteroid, prednisolone, dexamethasone?
We have yes, we use the that. Maybe I can show you, but not right now. Uh, we have some protocols, treatment protocols. These protocols sometimes we can change, but the Minister of Health yayınlamak published the guide. We have to use
Follow
the
that.
guides. Yes.
So you have to follow the guidelines, but with mild, you are giving them leniency to the doctors to change according to from case to case, but overall they have to follow the guidelines. Can you share one of
Yes.
the guidelines? You can share it with me later.
Okay. Of course. Of
You can
course.
share with me later. So
Okay.
apart from that, what is the status of medical colleges now? Are they open or closed? Medical
Sorry.
education.
Medical
Medical
education.
education.
Oh, medical education. Yes, we are open. We are open, but in Turkey, medical education during 6 years and first 3 years, the children stayed at home and following the lessons from their home online system. Unfortunately, and sorry, online system. But third, fifth, and the last years, we call them, of course, and the hospitals and the class course, of course, open. Medical education still goes on, but the first 3 years they are staying at home and attempt, unfortunately, online.
You said that 400 healthcare workers and doctors have died in Turkish. Our
Not
number in
only,
India,
not only, sorry, not only in doctors and nurses and
healthcare workers.
pharmacists. Yes, healthcare workers.
In India, 700 doctors have died. I'm talking about medical doctors.
Yes, too much.
So all over the world, doctors have died. Any special thing you are doing to save the doctors? Any special strategy? Because they are the frontline workers. Apart from vaccination, anything else being done to reduce
Uh,
mortality amongst them?
yes, first we are trying to reach every doctor to distribute protective equipment. first. After we try to make some moral them, and ne yapıyoruz başka doktor? We try to make COVID-19 an occupational disease for healthcare workers.
Okay.
And we try to shorten the working time to decrease the contact the virus.
So what Turkey has done it, they have declared for medical doctors this disease as a occupational health hazard. And they have reduced the time, and that is a WHO recommendation. All over the world, they have reduced the time. But it is unfortunate that in every country we are losing healthcare workers.
Yes, yes.
In 2021, we don't get them because of possible vaccine. Which vaccine is coming in Turkey? You told that again.
Sinovac.
So Sinovac vaccine, which is a killed vaccine, which is a killed virus vaccine.
Kill virus vaccine, yes.
Kill virus vaccine. And so who is going to get it? The doctors first?
The doctors, health workers will be the first health workers.
Okay. When are you going to get it?
when I going to get it, I don't know actually. Last week 3 million doses entered in the Turkey, but they are still working on it. They are analyze it now. We are waiting. We are waiting actually. And as I know, phase 3 study results did not announced yet. We are expecting the results actually.
That doesn't make a difference in a killed vaccine. So in a killed vaccine, when you have if you have a killed inactivated vaccine, it is much safer than others. So therefore, you don't want to wait for the results. You may not like to wait for them. So China has already given it to, since August they are giving it. So that data is available. It is safe.
In Turkey, Ministry of Health said that Turkey will take Sinovac killed vaccine. So it's done.
It's done. So I don't find any reason to worry. If it is a killed inactivated vaccine, nothing to worry.
We don't know yet. Nobody say anything. We don't know yet.
Doesn't matter because China has been taking it since August.
Yeah, I know. Doesn't matter, but our government
and they don't have any cases.
Yes. Of course, doesn't matter. But our minister said that.
Okay. So thank you very much, Gemzi, for being here. And it was lovely talking to you. It was
thank you very much.
Lovely listening to you. So someday we will again meet after the pandemic is over. And so let me thank and say good wishes to all people
thank you very
living
much.
in Turkey, to all of us, and that is living a corona-free time.
Yes. Thank you very much for everything.
That's all for today. We'll be back tomorrow 7 p.m. with another show. Keep watching Med Talks with Dr. K.K. Agarwal. Namaskar. Thank you very much. Thank you.
Thank you.